I'm now in my 50s and I've had a varied career, training as a surgeon before leaving clinical medicine to work in a senior managerial capacity in acute healthcare delivery. I've had the enormous honour of caring for patients and caring for a system that cares for patients at a local, national and international level. There's been a lot of events that have shaped me as a healthcare professional, but there's one in particular that I reflect on a lot even after all of these years. I was working in a busy teaching hospital, surrounded by colleagues, monitoring and caring for a ward of very sick patients. As a newly qualified doctor, it fell to me to administer the first dose of a drug that was prescribed maybe once or twice a year, as it was for very specific infections. Despite a lot of discussion and planning in the prescribing of the drug, there were a number of errors in the way it was written, and the final instructions led me to understand that it should be administered as a single injection. I wasn't sure what to do. I was on a surgical team, but I didn't understand anything about safety protocols. The rest of the team were in the operating theatre, the nurses were busy, and I knew I was expected to show initiative and self-reliance. I administered the drug in a higher concentration, rather than in the lower concentration that it should have been given. The patient suffered severe nausea and vomiting for the next 24 hours. He stabilised the following day, but he died about 2 weeks later as a result of his illness, and not as a result of my actions. However, I made his care worse rather than better. On the day, I thought I had killed the patient. I was devastated. I cried. I still remember the events as clearly as if it was yesterday. I also remembered that the event was brushed under the surgical carpet. Nobody mentioned the event. There was no review. There was no report. The boss may not even have been told. Most importantly, there was no learning from the event. I'm sure that other doctors have made similar mistakes since that event 30 years ago. What still haunts me, even 30 years later, is the conflicting elements of whether I am more upset about the discomfort of the patient that I caused in his final days, or the knowledge and certainty that other junior doctors have had to suffer the same distress as I suffered that day because of a lack of learning from my mistake. I don't know how to do this. Can you help me? Who needs to know about this? How can we learn from this mistake? Why are these still difficult questions to ask? I would not wish the patient's discomfort or my devastation on others, when both can be prevented by realizing that mistakes happen due to a lack of awareness and training, and that these mistakes can mark a person forever.